I think we are ready, are we?
Yeah.
Good. All right, done. So, welcome everybody. So happy that you are here to kick off our series on elder care. And I'm just absolutely delighted with the turnout. We had no idea when we started to think about this as a care team this summer, what was going to happen. And we decided that the elder issues were really something that everybody might be interested in, both in terms of us getting older and you guys, younger guys, trying to take care of us all.
Yeah.
So those that's kind of where we're at, right? So we're starting this series with number one. Don, yes, number one is Don Asaldia, and he is the Division Director of the Area Agency on Aging. And I just told Don, in all the cities that we've been living in, and in all the resources of the social worker that I've had to kind of dig out for people as needed, Area Agency on Aging is everywhere. It is in every county, in every state. And they are number one resource to go to if you want to really get the picture of what's going on. So this is a county resource. Don's going to tell us all about it, and his friend Kelly over there is going to talk about being an ombudsman in long-term care facilities, and they're also going to review for us housing options. Okay, so that's what we're going to be doing today. So I'm going to turn it over to Don, and I hope you all leave a little room at the end for questions.
Yes, absolutely, absolutely.
Thank you for coming.
Great, well thank you so much for having me here today. To me, what a blessed way to start the day is to talk about things that you are passionate about, and also talking to, of course, in this setting. I will say this, that in regards to community, right? We talk about community and how community should be there for everybody, right? Members of the congregation or members of, your neighbors. And it truly does start here. When we talk about providing that support, and you as individuals, right? Providing that support for your friends, your family, your neighbors, and of course your members and possibly your seatmates later on. And so we truly thank you for this opportunity. Kelly and myself, we're glad that we made this happen. And as mentioned, my name is Don Salvia. I am a nurse by trade, but I have not passed any medications in a while. I have traded it for events like this, and I am totally okay with that. And so I live vicariously through my other, of course, friends and family who are nurses, and I'm like, yep, I will be glad to just do a community outreach event, and of course, get these services into the community. So I have some slides today. I am also very long-winded, so please, Pastor, just kind of do the thing and just like, hey, let's go. So I totally get it.
There's a clock up there.
That was the first. That's actually the first thing that I look for when it comes to these events. I'm like, where's the clock, and who can I assign to tell me to get going? So really, it's assigned to all of you today. So we'll try to get through some of these slides. It has some information about aging information in general. And then, of course, information about the Area Agency on Aging, what we do in the community, and, of course, what services are available for the community that can be had through the AAA. So if there's any questions, please feel free to raise your hand, make a comment. I'll be glad to answer them. And then, of course, Kelly will also have some time to kind of talk about, what happens for that next step if we do have to move more into, a formal setting. So here we go. We know this, we've seen it, we are an aging nation and an aging community. So right now here in Kalamazoo, I apologize, it's pretty small, but 58,315 individuals are over the age of 60. So we're going to use that benchmark, age 60, because at the federal level, we'll go into this, that's what these Older Americans Act grants consider an older adult, right? We know it's about 90 plus, right? But that's just what the the federal standards we go by. So one of the cool things about Michigan is that Kalamazoo County residents are living longer than the state average. So here in Kalamazoo, the average individual is living 78.6 years as compared to 77.5. So you'll hear me say this many times today. Kalamazoo County is a great place to age in. So we see that with the data, and of course we see that with not only the resources but the individuals at those resources. And I'm excited when I was looking at the schedule of what's coming up. You have some great people coming, passionate people who are here to provide those services. So it's really excellent place to be. So this is kind of what we've seen on the national level as well. So by 2060, 25% of Americans, so all of America, 1 in 4 will be at or over the age of 60. So in comparison, here in Kalamazoo, by 2029, that is just a stone's throw away, we will be at 23% of Kalamazoo County residents at or over that age. So we are seeing and kind of riding along those national trends, we know that. But of course, the good news is, there's so many supportive services that one can tap into. So now we're going to talk about the area agencies on aging in general. As mentioned, they're everywhere. They're all around. And so some of that history actually started in 1965 for the Older Americans Act. So even in 1965, even though they didn't have that data for 2060 or for 2029 in regards to what the nation or each state is looking like, they recognize that, hey, you know what? We need to set aside some funding that's separate from Medicare or Medicaid, specifically focused on providing resources for Americans to age in the comfort of their own home. So that was even way back in 1965. So that's really what started the funding for the area agencies on aging, and it started to trickle down to the states. So here's what it looks like here. So as mentioned, in every state of the nation, in every county, there is an area agency on aging. Now, they might not be called AAAs. Over in Battle Creek, they're known as Care Well Services, but they're usually called AAAs, not the automobile auto insurance. So my partners up in Grand Rapids, their AAA office is literally a few blocks away from the actual automobile owners association, and they have literally a map. So when you go in, they're like, "Hey, I'm here for the AAA." They're like, "Which one?" So they have a little paper to map how to get there. Community service providers. So AAAs are their own freestanding organizations. One of the mandates from the state and the federal level is that we have to be unbiased. So an insurance company can't say, "Hey, we're a great insurance company. For every referral that you give out to us, we will give you a kickback." That's on the state and federal level. That is a no-no. So all of the resources that we have are based on quality standards set by the state, and arguably we have to vet those to make sure that they're meeting state standards, and that's really that measurement. We don't get any kickbacks. We have to be completely 100% unbiased for that information we are giving out to the community. And so we have a whole bunch of service providers, thousands upon thousands of them nationwide. We also have a broad service availability. So qualifications for each AAA are pretty standardized no matter what state or what county you're in. Pretty easy. You have to be at or over the age of 60, or you have to be a caregiver for someone at or over the age of 60. You have to be a resident of the service area. So of course, here in Kalamazoo County, you'd come to us. If you lived in Calhoun County, like, "Hey, you know what? There's a great partner agency. Here's their phone number," but we just try to get you into the right area. The two big things is that for Older Americans Act dollars, there is no income requirements. So you can have someone very well under that poverty level. You can have someone very much well over that. What we have recognized with the Older Americans Act is that aging and the needs, the resources that an aging person needs, that will happen regardless of income levels. So purposely built with the Older Americans Act that it is a very broad service category. No insurance requirements. And so with that, a lot of services that you might hear, one of the first questions they ask is, okay, do you have Medicare or Medicaid, right? Because that's going to be that first question. Here doesn't matter because we want to make sure that we're able to provide those services as quickly as possible without as many barriers as possible for that older adult to age in their home, right? So that's arguably some of the bigger highlights of the area agency on aging, that ultimate goal of helping an older adult age in their home. So just a quick structure-wise here in Michigan and Kalamazoo County, at the federal level, we have the ACL. Then we kind of move down to Michigan Department of Health and Human Services, and then that starts trickling down into Kalamazoo County. This is where we are, our governing body is here, is Kalamazoo County government. That's pretty unique. Only 2 agencies here in Kalamazoo County, area agencies on aging, are actually attached to county government. So when you hear AAA, don't automatically think, oh, that's part of county government. It's not. It's just one of the unique things about us specifically at AAA. You'll notice we have 16 other area agencies on aging with this map over here on the far right. So there we go. And so again, it's just kind of making sure that we're matching out that individual to that service area. So why is it structured like this? Why do you have an area agency on aging within each county? Well, we found that this is actually much better than just a broad Google search, right? Aging resources. One of the other mandates that an area agency has, other than being unbiased, is that they have to be professionals, knowledgeable. They have to have a full understanding of what those specific aging-related needs are within that county. Right? So the needs for like a bigger city, like over up in North in Grand Rapids or Detroit, could be very different than the needs here in Kalamazoo. So that's why we don't have one big area agency on aging for the state. That's why you see those really drilling down into that local community level. And so what that looks like is this. So one of the things we do is going out into the community and having conversations, having information sessions, sending out surveys to find out what those specific needs are within Kalamazoo County. Once we've identified those needs, that's when we can start allocating our funding to support local organizations to fill those needs. And arguably, these are the top 10, dental care, access to nutritional foods, homemaking and chore services, corrective lenses and frames, hearing aids, socialization, decluttering of home repair, safety modifications, medical equipment, and legal services. So, arguably, is there a service for each of those, funded by or associated with the Area Agency on Aging? Yes. Yes, there is. Now, some of them are new, so we're building that up. This is from our needs assessment that we just completed this year. So with that, we've identified, like, hey, you know what? This is new. And especially, following the pandemic, following a lot of the changes for the last couple of years, this is what AAA's had to do. Hey, what are the needs? And where can we allocate some funds to make sure that's available to the community? And thankfully here at Kalamazoo, we can meet all of those.
Number 7, that's me.
And so kind of moving in, I know this is really small, but this is where, right, I know, right? But I simply have this up there, so I'll point you over to those tri-fold pamphlets that we have. There we go, and I did have more at that back table, just in case you need some.
That's these.
Yep, there we go.
Who needs one?
Anyone need an extra? Okay. There we go. I got the next one over here. All right, perfect. And so right now, these are all of the available services that is associated with the Area Agency on Aging. Probably the first thing that I would like to point out is the yellow column to your left as compared to the white columns on your right. So the ones in the yellow column, those are services directly associated with the Area Agency on Aging. If you're accessing those services, you're actually going to be calling members of my team. The big ones for that is a resource helpline. So if you have any question about any one of these services, simply, hey, where do I start? That would be that phone number, 269-373-5173. And my staff members, Anna or Sherry, would be glad to talk to you. They're going to be that gateway to all of this information. We also have a care management program. So that's working with individuals who are needing a little bit more assistance. And that's actually a multidisciplinary, so it's a team approach of both a nurse and a social worker to help that individual in their home and their caregivers and get those resources accessed. And along with that, you get a care manager to help walk with you through that journey of keeping you as independent as possible, aging in your home for as long as possible. Our ultimate goal with care management is to prevent that long-term care placement in a nursing home. And it's great. This is where I started off 10 years ago, and we have had clients who have been with our program 10 plus years, and we really get to develop that relationship with them. We have the Medicare Assistance Program, which is an insurance question and support service. If you call one of them, they can actually help you walk through Medicare, Medicaid issue, and even finding an appropriate insurance plan. So I know open enrollment is coming up soon. You're probably going to start seeing those commercials on TV. If you want an unbiased opinion of good or what are some good supplemental insurance plans, that would be that Medicare and Medicaid Assistance Program right there. Yeah. And of course, we have the Long-Term Care Ombudsman. I'm not going to talk too much about that because we actually have Kelly here. But of course, Kelly works for a state body that helps advocate for older adults who have to move into that long-term care setting. Now, the fun one is the two white columns on the right of that trifold. These are all of the community organizations, these community-based services that are associated with the Area Agency on Aging, and we provide them funding to grow and provide more services that's available to the community. So the first question, what are the costs of said services? Who wants to take a guess? Nothing. Nothing. The only exception would be our hearing aid program. So they do have a $75 copay, but they're willing to work with individuals for that. But that $75 copay gets you either a $1,500 set of hearing aids up to like a $3,000 plus set of hearing aids. So going back, right, to those first slides, qualification, are you living in Kalamazoo County? Sweet. And are you at or over the age of 60? Great. Sweet. You know, give a ring to any of these organizations. Now, keep in mind, it's all grant funded, so it is limited, you know, in regards to how much individuals they can work with. But they are all excellent organizations. They can help and, of course, walk through that scenario with any of their callers.
Do you want to mention the village?
Oh yeah.
Or is that coming up?
Oh yeah, that's coming up. I got some slides for that.
All right.
And so
we're
yeah.
all voters.
Exactly. So and it's an important thing. It's a very, very important thing, and that's where I'm going to get more passionate as we go on. So probably the big ones that I really want to point out that we're really pushing now, because surprisingly, one of the big things that I hear is like, hey, did you call this X and Y organization? And they're like, that sounds too good to be true. That sounds like a scam. It's like, no, this is real. Like, it's here. One of the big ones is we have a prescription medication assistance program. So individuals who have a prescription from the doctor, if their insurance doesn't cover that, Advanced Healthcare Pharmacy will cover up to $600 worth of prescription medications. So that's insulin, diabetic supplies. If you're working with insurance, if you get into like the donut hole, so that's where your insurance all of a sudden has no coverage because you've spent so much with it. There's a prescription medication assistance program there. We have a whole bunch of home safety and repair services. So, yes, question?
Don, real quick,
yes.
$600, is that per event, per month, per year?
Sure, so it is a one-time. Great question. It is a one-time for the calendar year. However, Advanced Healthcare Pharmacy, they are a really great organization. They will work with some individuals about what some of those other options are. With them too, they also provide free medication dispenser machines. So, you know, they look like a saucer and you can kind of fill it and it kind of opens. With that funding, that is included as well. So again, amazing services that are out there. Home repair is a big one. Another big one we have that kind of supplements is our Senior Veteran Support Program. So if you are a member of or a veteran, you don't have to have served in like active war time frame. But that, if you reach out, you get up to $6,000 worth of dental work, because dental work is actually one of the big things that's not covered by the VA. And so if an older adult who's a veteran needs dental work, they can actually go to their own provider and work with our Veteran Service Office to get some more services that's not covered. And so there's a lot. I can talk really an hour for each and every one of these services, but there's so many things out there. The one that I'm kind of excited, I hate that I'm so excited about this one, but even bed bug remediation. You know, it's right. It's a huge issue. We're seeing it all over, and so now that we have some funding, that an older adult can, you know, get a treatment for bed bugs, it's expensive, right? And it's amazing how much the cost of said service is basically that limitation for an older adult getting what they need to age at home, right? That's why we have our grants, that's why we have our senior millage, is to start breaking down those barriers. And so, again, there's a lot. Just want to take a minute. We'll do some questions at the end, but is there any one of these that anyone has any specific questions on right now? Okay, great, excellent. So come find us. I have some more cards at the back for information and assistance line if you want some more information about these. But yes, there is a lot out there. There's a lot out there. So please feel free to access and get your questions answered. And so we kind of talked about these. So 24 unique programs to help older adults age at home. That white column on the right there. And of course, we are funded by state, federal grants and the Kalamazoo County Senior Millage. And I do have the website. And I can share this slideshow if that'll be helpful. I can email this out if you want to share that. We can absolutely get this here. So when you do call any area agency on aging, I actually want to have this up here. So raise your hand, right? Our social workers and medical team, social determinants of healthcare. We know that there is so much more than just healthcare that affects an individual's, access to those supportive services. So every area agency on aging that you work with can help an older adult or their caregiver kind of walk through and examine all of these elements that could be a factor for them either accessing services or having this as good knowledge moving forward to say, hey, here's my need, here's what could be a limitation, let me kind of focus on this area. So we look at that, and see all of these elements, education and access to quality care, healthcare, neighborhood and built environment, what does their neighborhood and their community look like? What is their social and community support, right? This is why this is important. And then even their economic stability as well. So we examine all of these things, as a AAA, as an organization, and we also examine these things and have these conversations with each and every one of our individual callers. Yes?
Is there someone that would go into your house and talk to someone, sit there and help? We have some people that can't drive, have problems figuring out a lot of kind of appointments and all that. Is there somebody that would go in and kind of be the advocate?
So sure.
I mean, for everything?
Ooh, good question.
Just to help them decide who to call and what.
Yeah, absolutely, good question. So we are building that specific program up right now. Just because of the needs and staffing, a lot of what we do is phone-based, telephonic, we could do Zoom. We do have limited capacity to go in home. That's kind of the availability of our information and assistance team. If not one of them, it would literally be possibly me or one of my other care managers. So we do have the ability. It may be a little limited, but we find that there's absolute value in that. And right now we are actually building up some programs to provide more of that on a quicker, much more available basis. So don't feel free that you can't ask, please do. There we go. Right. Gonna sweep back over here. So now the big thing, and I always kind of want to talk about this, taking a look at the annual cost of care. And I always bring this up just so individuals can kind of have an idea of, hey, if I had to start paying, right, for that in-home supportive services or planning long-term care, what does that look like financially? So there's actually every year a big state study called the Genworth Cost of Care Survey. So this is what it looks like. If I were to pay an in-home caregiver at the market value for 40 hours a week of in-home care, that would cost you $60,000 annually. That is all out of pocket. That is not covered by insurance. Not covered. And so that's at the average rate of 40 hours a week at $29 an hour. That next step, and Kelly will kind of go into this a little bit more, if you were to move into either an assisted living facility or adult foster care, something where there is that home health aid available to you to help with that assistance. That cost is at least $51,000 annually. keep in mind that that is usually just that base rent. For some of those additional services like bathing, making food, laundry, that's all kind of added in to that base cost. So that's
That is on the low side.
that is on the low side. That's on the low. Right, and you're probably seeing or work with individuals with that. That's low. So now we're going to move into nursing home, right? If you're actually going to like a formal nursing home setting, what does that cost look like? Semi-private room, $109,135. Kelly probably has some more up-to-date figures. It's only going up. If you're having a private room, $118,260 for 1 full year of care. Now, granted, this is usually covered by Medicare, Medicaid, or insurance, but that is expensive. And to finally get to a place where insurance is finally covering it out of pocket is way down the road. You're no longer in a home environment, right? And so in comparison, with our state and federal grants, how much does it cost for us, because we are tapping into our grants or the senior millage, to provide arguably that support to keep an older adult at home? It only costs us $4,800 to $6,000 per year to keep an older adult aging in their home. And what do you get with that? You're in your home. You're getting the support you need. You're still a part of the community, right? You're still a part of a congregation. You're still in your neighborhood. There's so much value, not just the cost, but even just for that older adult to have that ability to age at home. When you compare this to the nursing home beds, and this is older numbers, there's actually much more active nursing home beds now. 785 nursing bed homes in Kalamazoo. When last time I ran this, I know it's higher. But if we kept 10% of those beds unoccupied using our state, federal grants, and our local senior millage, we are saving taxpayers $8.5 million annually. It's absolutely amazing how much that cost of their care costs to have an older adult in a formal nursing home institution. So there's value, so much value, to have them aging at home. Yes?
And that bed number, or the updated one that you don't have,
Yeah.
is that sufficient to meet the needs in Kalamazoo, or are there waiting lists?
So for nursing homes, Kelly?
There's, a waiting list if you wanted a specific nursing home possibly, but there are beds available.
So I'm going to talk right now, I'm going to give it over to Kelly. So this is why it's important, right? So I love this quote. All of us, at some time or another, need help. Whether we're giving or receiving help, each one of us has something valuable to bring to this world. That's one of the things that connects us as neighbors, connects us as a community. In our own way, each of us is a giver and a receiver. So, who do you think said this? My favorite person, Mr. Fred Rogers. I missed that. I should have wore a cardigan this morning, right? So when we talk about community, again, I've said this maybe like 5 times already, Kalamazoo County is a great place to age in. For many reasons, and one of that truly is because we have the senior millage.
Yes.
All of those services, all of that prevention for that cause of care, the ability for our community to be a community, to have the supports to keep older adults at home and to keep the caregivers who could be helping for them, supported. It's because we have this. 28 unique services and programs. So a snapshot of the last year. We have worked with 32, more than that, active contracted providers. We provided over 9,500 hours of care management, so face-to-face, working with older adults with a nurse or a social worker. We delivered over 170,000 home-delivered meals. So an older adult is getting a nice, hot, fresh meal delivered to them on a daily basis, 170,000. We provided over 35,000 miles of assisted transportation. That's, I believe it's 1.5 times around the globe, right? We're going for 3, right? So we've had a lot of transportation services. Over 75,000, close to 76,000 hours of in-home care. So an older adult is receiving in-home care by a trained professional caregiver. Over 65,000 hours of adult daycare services also provided for an older adult to go to one of our adult day centers. So we served over 8,400 individuals in 2022. We're all set to exceed that in 2023. I'm excited to see, all of our final statistics. And this is available to all in the township. This is a Kalamazoo County senior millage. It is here to support the community. It is available and it is working. And we're excited to see that, and of course, excited to have these services available. So this is more of like, oh yes,
Just a quick question, I mean, I think, finding qualified staff is challenging in this environment especially
oh
currently.
absolutely.
So, I mean, I love the enthusiasm and all these services, and it sounds like you're doing a great job. Are you really finding that it's really difficult to meet the demand because of staffing needs?
Absolutely, and this is what we're seeing not just here in Kalamazoo, not just community services, this is here, this is in formal settings, this is at the state, this is on the national level. One of the biggest crises we have right now, right, is what this looks like. We have an older adult population who is increasing as years go by. We have a younger workforce that's only decreasing. And so the direct care worker shortage was a thing years ago. It is much more, it's that and more. So this is where we're kind of supplementing both our millage and our state and federal funding. Right now I just got word that the state is actually providing a $3 direct care worker incentive. So for every hourly pay a direct care worker has, the state is going to give them an additional $3 on top of that. So we're doing a lot of initiatives. Now it's going to come to this though. Could you throw money at individuals? Absolutely. But the challenging thing is we simply have a declining workforce. And we're kind of seeing that across all factors. So that's something, again, that the AAA is actually even having that on a national level. It is a huge challenge right now. Yes.
Thank you.
But right now, for those services in the trifold, there is no waiting list so far. Now, granted, if everybody reached out, today, perfect, great, right? You're doing what we think you've done. But there's actually no wait list right now for any of those services in your trifold. The only exception would be for our care management program, simply because I've yet to hire the 3 staff members to kind of increase our capacity. So there is that time where you might have to go into like more nursing or like more supportive settings outside of the nurse or outside of the home environment. But I'll let Kelly talk about that. And
I don't have a slideshow. It's okay, Kelly. That was great done. I'm Kelly Yunker. I am your long-term care ombudsman for Kalamazoo County. We also have Trish Wood, who with the millage is specifically of Kalamazoo County. Our area completely for the ombudsman program, I cover 5 counties: Berry Branch, Calhoun, Kalamazoo, and St. Joseph counties. In those counties, we are responsible for 6,696 residents / beds. So having 2 people, I used to do this all alone. I've been an ombudsman for 16 years. So we really like Trish here. The facilities that I cover, well, let me go back. The ombudsman program is something unbiased also, but we are advocates for the residents specifically. We will take, guardians can call in, family members, loved ones, or a DPOA can call in, no matter what their concern is, and it's confidential both for family members to call me and for residents to call me. It's 100% confidential unless you want me to do something. Even if I have a resident that tells me they're being abused, it is 100% confidential unless they want me to actually do something or, push that forward to either get law enforcement involved, to get, any type of that.
So you're not a mandated reporter?
I am not a mandated reporter. And that's been that way for, since the Older Americans Act of 1972. Generally, if I have a resident that tells me that they have been abused, either financially or verbally or physically, the longest resident that I had that kind of didn't want to do anything was 3 days. And I always hope, because I always say, if it's happening to you, it is definitely happening to someone else. So I'm an advocate. We go into, and on the brochure it says, advocates for nursing homes, homes for the aged, and adult foster care homes. When you hear the term assisted living, that is just a marketing term. When you hear, oh, we have a certified, or we have a memory unit, there is no license for that. There's no training for that. Some facilities maybe do give a little bit of more training. So I'll break down the different homes for the age. So our local would be like Portage of Bickford. That is actually licensed as a home for the aged. Then you have a large adult foster care home. That would be something like Park Place, Vibrant Life, the Fountains. Those are all large adult foster care homes. There are a few of the assisted livings that are not licensed, and that would be like Fountain, Bronson at the Fountains, Friendship Village. Their assisted living side are not licensed. And then you have your regular adult foster care homes. An example would be Sue's Loving Care. That's a smaller home. They only take like 6 residents, but that would be a small adult foster care home.
And that's licensed, she would be licensed?
Yes, yes. A disclaimer, all of the homes are gonna be either not so good or they're gonna be good. But that can change by one employee. And it changes frequently. I can have a nursing home, I can have a Bickford Cottage or the Fountains or Brookdale. I can have them doing really, really well, and then things happen. Or I don't know if you have friends or family, the directors and administrators are on a revolving door constantly. Specifically to the homes for the aged, I kind of put together over this weekend on the flyer checklist.
That's this one.
If you are considering a home for the aged or an adult foster care home, they are licensed by the state of Michigan. For like, let's say a place like Bickford, and I'm not picking on Bickford, I just know a lot of people know Bickford Cottage or Brookdale or, you know, those. For a home for the aged, a Bickford, this is all the rules and regulations. And there's really only like 2 pages that are for the actual residents' rights. All of the remainder of the rules and regs are for the licensee, which would be the owners of any adult foster care home. Compared to a nursing home, which is hundreds of thousands of pages. It doesn't make one better or, you know, better or not better. I always stress on that flyer, for a Brookdale, any home for the aged or adult foster care home, all you need is a GED to pass medications, to be a caregiver. There's no, they don't require the certified nursing assistants. It is just an aid. You have to ask questions going to any assisted living / the home for the aged or the adult foster care home. There is a service contract that licensee says that between a resident or the DPOA or guardian, between the establishment and licensing, there has to be a service contract. Take your time when reading those. Make them specific. My best example is, and I hear this, I would say in 1 month, every month I probably get 3 or 4 phone calls regarding these assisted living / home for the aged. I just visited my dad again, and he is filthy. He has greasy hair. He's got food under his fingernails. It looks like he's worn that shirt for days. And the assisted living or home for the aged will say, well, the family member will go, you said you were going to bathe my loved one. You said you were going to, you know, make sure that they get new clothes every day. They were going, you know, do these things. And the assisted livings will come back and say, we told you we would shower your dad. We didn't tell you how often. So now that you want us to like shower your dad, do you want it every day or do you want it a couple times a week? Oh, a couple times a week. Well, that's fine. Now we can do that, but it's gonna cost you. You were at level 1, now you're gonna have to go to level 2 because you want your dad bathed 2 times a week. The service contract, you need to spell it out. An admission person is going to be the person that is trying to get you in. They're going to be, And that's basically the only person that you're really going to be dealing with, maybe if there's a licensed practical nurse or an RN. They do not need an RN or an LPN. Some of these homes do have RNs and LPNs, but you do not need them. I always say, take your time, go through the contract, write down what your loved one really needs, or yourself, what you really need care on, and let them give you a price. On average, and I have been told by this, number one, that that admission person is going to make a finder's fee for bringing you into their establishment, and it's around 3 months, they will say, even after, we did an extensive assessment, you're gonna slot in at $4,500, tier 1 or level 1. Every 3 months, they are pushed to reassess. So when they reassess, I would also be there when they do the reassessment. My dad's always needed to help being transferred to the bed and back. And now you're saying that he needs more help. And I also noticed that even though I'm paying more now for all this extra help, I only see 1 or 2 staff people for the entire facility, and we have 60 people in this facility. So just really ask questions, take your time, do not be pushed. If you have questions, you can call me. I will give you an unbiased. There is also, you can go online for licensing investigations. You can file licensing complaints either online or by phone. With this many rules and regulations, it's very difficult to establish a citation. But they need to know. The main person that can really help you, I can definitely help to either relocate someone if you want to move, or just bring in licensing, and that's Adult Protective Services. Adult Protective Services covers adult foster care homes and these homes for the aged. Or the police.
I can't comment on any facility in Kalamazoo County because I don't know, but I have experience in the state of New York in long-term care. One of the things that was apparent in New York was to know whether a facility was a for-profit or a not-for-profit. And it was very clear, at least in our environment there, that many of the for-profit places regarded their residents as a means to an end. And the not-for-profits generally were more interested in healthcare and providing care without regard for profit. And it was a huge, huge difference. I happen to be with a not-for-profit, by the way. But that was a key factor there that when somebody asked me for a recommendation of a place, I said, start with the not-for-profits and go from there.
Michigan, I could say both on both of them. I will definitely agree with you that generally the nonprofits are going to be the better facilities. I always say when someone is touring these nonprofits and you walk in and it's got beautiful wallpaper, there's fresh flowers everywhere. They've got now these scents in the air that actually give me migraines. And people with dementia, it actually affects and it causes behaviors. Even if that scent is like pumpkin pie or something, those are all not essential oils, so it actually has caused behaviors. But all of those or all of the beauty in that, where is their money going? To decorate. Yeah. And then you look, there's 90 residents and there's only 2 aides on duty. How is that possible? I hear that all the time. I'm paying a lot. For an assisted living, I'm paying $12,000 for what? Because there's only 2 aides. There was 2 aides during daytime, 1 aide during the evening. where is my money going for care?
In our case, about 80% of our budget was personnel costs. So if you're going to make money, place you make money is by cutting your personnel.
Yep.
But
Oh,
also,
definitely.
Simple
there's
as
the
that.
point Lori brought up about the shortage. I mean, where my dad is, they had lots of staff, now they just can't find them.
Yeah, that is true. 'Cause you were,
Yeah, Kelly, thank you. You really are providing great guidance today. Get the contract, read the contract, figure out what it says, ask questions, get a price. And sometimes we're in this, oh my gosh, the hip surgery is done, we gotta get to a nursing home, boom. We got, 3 days to get all this covered. So sometimes there's this massive time crunch to move fast. Can you tell us about those dilemmas that families and patients and nursing home residents face? Like, how do you deal with that, the speed and velocity of some of these decisions?
I always even still say, slow down, calm down the discharge planner. Can we bring them back to an assisted living? Or can we bring them back in the home? Because PT, OT, and speech will come to your home. If it's a nursing home, they're not gonna, just because your loved one just had a surgery or fractured hip, any of your assisted livings are not gonna bring in extra help. They are not going to. They're gonna say, oh, we can take care of it, or again, we're gonna charge you $700 until that they can transfer by themselves again. And then again at an extra amount of money. On a nursing home, when that happens, or if you're looking at a nursing home and not sending the person back to home because they need 24-hour care. So I brought this. They have done studies and all the time studies. So the staffing, needing 24-hour care, the staffing ratios that an actual staff either puts hands on you to help you change or whatever you're going to do, or to bring you to meals, or just talk to you, is 2.25 hours in a nursing home. That's it. That anyone's gonna have eyesight on you, unless you're a person that is zipping down the halls, then by all means, they're going to, but only 2.25, which they're trying to increase right now, CMS, but that hasn't, or it's not all the way through yet. In a nursing home, day shift, 1 nursing care employee, which would be an LPN, per 8 residents. Afternoon shift, 1 nurse care employee for every 12 residents, and night shift, 1 nursing care employee for every 15 residents. And these are people that need Hoyer lifts, these are people that need 2-person assists. I always really try to go back and forth to say going home, is that really maybe even a safer option? But it is a dilemma. And you can call me, especially if you're like, I don't even know what nursing home to go to. We can talk about that, because I mean, I can give you current, recent surveys. Maybe they're in immediate jeopardy right now. Maybe they have a ban on admissions because of care. And I can tell you those things. I always say, visit. And do not call and visit when they say, oh yeah, why don't you visit at 6 p.m.? That's when most residents are gonna be on their way to bed. There's gonna be, they kind of transition. Visit during meal times is gonna be your best bet, or around 8 p.m., 9 p.m. And then you can see how many staff are in any of these buildings.
Isn't there also a website, a Laurel website, to see who's got licensing?
CMS, yep.
So I will say that I was a nurse's aide for a few years, and I worked at a couple different types of facilities. And first facility I worked at had different regions to the facility. So there was the area of the facility for people who were recovering from the hip surgery and whatnot. I was placed in the long-term care area. It is an 8-to-1 ratio for the aide. I think the nursing staff had a different ratio. But that had certain things that I was expected to do and accomplish with the people who needed that care. Down the hall was an assisted living section, and we had a resident who was accidentally misplaced there, and what we were told was people in that space were expected to do almost everything themselves, and the one aide that was there the job was to kind of answer the call light, right? So it was sort of like an apartment with an aide. But when I worked midnights, I did have a 15 to 1. Most of the people were sleeping. My job was to check beds and make sure people were dry and cared for and turned, and if somebody was up. But again, at 15 to 1 wasn't terrible. So I know it sounds awful, but you really don't need me sitting next to you
Oh,
while
no.
you're sleeping either.
How would you do a 2-person assist though, or even a 3-person assist?
There was usually 3 aides on the floor at any night, plus the nurse. I mean, it was a larger facility, so probably 45 beds. It's not the Fountains, it was the other Brunson.
But the Springs,
I don't know what it's called now, it's been a few years.
the Springs, we shut them down.
Oh, well, fantastic. 20 years ago, I enjoyed working.
Yeah, that was a smaller facility, yeah.
Yeah, but I was midnight shift, it was 15 to 1.
Yeah.
But I think, Kelly, your questions that you say ask, those are to prevent some of these horror stories. I mean, if you ask the right questions, you can place into a really great match.
Yes,
I mean, my dad's in a place and he's been level 0 for 10 years. And
Good.
we've asked recently, does he need to go to level 1? And they say, and it's not in Kalamazoo, well, we can give him this care and not change his level for 2 or 3 weeks, and let's see how it goes. I mean, we're not running into a scam to get all our
then
money.
that's a good, I mean, I like that, that's great, you know, definitely, I like that.
But I'm so, yeah, if you ask the questions, you might get a good, they're not all bad.
Yeah. But I think a lot of people, and also once you get in there, and they'll say things like, oh, well, you're the only person that has this concern. That I think they learn right out of, you know, immediately. But I would ask as many questions as possible up front. And also visit a lot.
Yes.
I have been told, and I also see, visit often and at different times, even if you're fluctuating 30 minutes here or there, because they get used to you, and they generally will also help those person, especially if they're really busy or someone has called off. They will definitely make sure that your loved one is cared for, because they don't know when you're gonna visit.
So, I don't know if we're wrapping up, but I mean, I guess what I'm kind of hearing is, I mean, obviously people need care. The goal
Yes.
all would be, if you can age in your home, that's like your best case scenario for sure. There's lots of services out there. There's good ones. There's ones that need work,
The
and that can
struggle
change
or-
over time.
Yep.
You're like a person that if something goes awry, there's a person that you could call, and you have information to kind of help direct what to do. And so really it's about making sure that you do very thorough evaluation, you set your expectations accordingly, and then you continue to be an advocate for the person that you're caring for in that environment to make
Yes.
sure that it's continuing to meet the expectations you have. I mean, is that a good summary?
Yes, be very active, yep. Because I have homes in different counties that are only like 1-star facilities. There's a lot of